What if your eyes were quietly trying to warn you about a serious problem, and the signs were so subtle that most people dismissed them as simply getting older? Many vision changes do occur naturally with age, but researchers and eye care professionals also recognize that certain changes should never be ignored, especially after the age of 60. Some warning signs develop gradually over months, while others appear much more suddenly. Understanding the difference may help you recognize when a change deserves medical attention. Today, we'll explore 7 early eye warning signs men over 60 should never ignore, along with what researchers and eye specialists say about healthy vision and aging. One of the final warning signs is often completely painless, yet it may have significant implications if overlooked. Hello, I'm Dr. Natalie, and welcome to Men's Health Today. Our goal is to help men over 50 better understand healthy aging through evidence-based medical education. If you enjoy learning about heart health, prostate health, nutrition, healthy vision, sexual health, and longevity, consider subscribing so you don't miss our future videos. Before we begin, I'd like to remind you that this video is intended for educational and informational purposes only. It should not be considered medical advice, diagnosis, or treatment. Vision changes can have many different causes, ranging from normal aging to eye diseases and other medical conditions. If you experience sudden vision loss, severe eye pain, flashes of light, or any concerning changes in your eyesight, seek prompt evaluation from a qualified eye care professional. Now, let's begin. Meet David. David is 71 years old. For months, he noticed that reading small print had become more difficult. At first, he blamed his reading glasses. Then he noticed something else. Straight lines occasionally looked slightly wavy. It wasn't dramatic. Some days he barely noticed it. Other days it seemed more obvious. Eventually he scheduled a routine eye examination. His eye doctor explained that while many vision changes are part of normal aging, others deserve careful evaluation because early detection can make an important difference. That appointment reminded David of something many people forget. Healthy vision isn't just about seeing clearly. Regular eye examinations can also provide valuable information about overall eye health. David's experience isn't unusual. Many age-related eye conditions develop gradually, making it easy to overlook the earliest warning signs. Let's begin with the first one. Warning sign 1, blurry vision that doesn't improve. Most people experience occasional blurry vision. Dry eyes, fatigue, or even poor lighting can temporarily affect how clearly we see. However, researchers and eye specialists emphasize that persistent blurry vision that doesn't improve deserves professional evaluation. Blurred vision may be associated with many different conditions, including changes in the eye's lens, retina, cornea, or other structures. It doesn't automatically indicate a serious problem, but it also shouldn't simply be dismissed as normal aging without an appropriate eye examination. Is blurry vision always caused by needing stronger glasses? No. While prescription changes are common with age, blurry vision can have many different causes. That's why eye care professionals recommend comprehensive eye examinations rather than assuming new glasses are the only answer. One of the encouraging things about modern eye care is that many vision problems can be identified during routine eye examinations before they become more serious. That's one reason regular eye care remains an important part of healthy aging. The next warning sign surprises many people because it doesn't affect how clearly you see. Instead, it changes what you notice moving across your vision. Let's look at warning sign number 2. Warning sign 2, new floaters or flashes of light. Many people notice small floating spots or thread-like shapes drifting across their vision as they get older. These are commonly called floaters. In many cases, a small number of floaters develop as part of normal age-related changes inside the eye. However, eye specialists emphasize that a sudden increase in floaters, especially when accompanied by flashes of light, deserves prompt medical evaluation. Researchers explain that these symptoms may sometimes be associated with changes affecting the retina, the light-sensitive tissue at the back of the eye. This doesn't mean every new floater is an emergency, but sudden changes are different from the gradual floaters many people have noticed for years. Are floaters always dangerous? No. Many floaters are harmless and become more common with age. The concern is when new floaters appear suddenly, especially alongside flashes of light or changes in vision. One of the most important lessons in eye health is recognizing changes rather than focusing on symptoms you've had for many years. Researchers encourage people to pay attention to anything that develops suddenly or changes rapidly, because those situations may require timely evaluation. The next warning sign is often overlooked because people assume it's simply due to tired eyes. But if it continues or gradually becomes worse, it's worth discussing with an eye care professional. Let's continue with warning sign number 3. Warning sign 3. Difficulty seeing at night. Many older adults notice that driving after sunset becomes more challenging than it used to be. Headlights may appear brighter, road signs may be harder to read, objects may seem less clear in dim lighting. Researchers recognize that some reduction in night vision occurs naturally with aging. However, progressive difficulty seeing in low-light conditions can sometimes be associated with age-related eye conditions that deserve evaluation. Again, this doesn't point to one specific diagnosis. Night vision can be influenced by several different factors affecting the eyes. The important message is not to assume worsening night vision is simply part of getting older. Does everyone lose night vision as they age? Some age-related changes are common. However, the degree of change varies from person to person. Persistent or worsening difficulty should be discussed with an eye care professional. Healthy vision involves much more than reading letters on an eye chart. Researchers continue emphasizing that functional vision, such as seeing clearly while driving at night, is an important part of maintaining independence and quality of life as we age. We've already discussed 3 warning signs, but the next 4 are the ones eye specialists often hope people recognize earlier. One of them affects how straight lines appear, and another can quietly reduce your side vision without causing pain. Let's continue with warning sign number 4. Warning sign Nash 4, straight lines that look wavy or distorted. Imagine looking at a window frame, a doorway, or the lines on a notebook page. Normally those lines appear straight, but if they begin looking bent, wavy, or distorted, researchers and eye specialists recommend having your eyes evaluated promptly. Changes like these may sometimes occur when the central part of the retina is affected. The retina is responsible for capturing the images we see, while the central area, called the macula, plays an important role in detailed vision. Because reading, recognizing faces, and many everyday activities depend on this central vision, even small changes may become noticeable. This doesn't automatically mean a serious eye disease is present. However, researchers emphasize that new distortion of straight lines should never be ignored. If straight lines look slightly different one day, should I panic? No. Temporary visual changes can occur for many reasons. The important message is that persistent or worsening distortion deserves professional evaluation, rather than simply waiting to see if it disappears. One of the advantages of recognizing visual changes early is that many eye conditions are easier to evaluate before significant vision loss develops. Researchers consistently highlight the importance of early recognition rather than waiting until vision becomes severely affected. The next warning sign is especially challenging because it develops so gradually. Many people don't notice it until significant vision has already changed. Let's look at warning sign number 5. Warning sign 5, gradually losing side vision. Most people naturally pay attention to what they're looking directly at. Very few people notice changes occurring in their peripheral vision, also known as side vision. Researchers explain that certain eye conditions may gradually reduce peripheral vision over time. Because the change is often slow and painless, the brain can partially adapt, making it difficult to recognize what's happening. Some people only become aware of the problem after bumping into objects, having difficulty noticing movement beside them, or discovering changes during a routine eye examination. This is one reason comprehensive eye exams remain such an important part of healthy aging. Can I check my own peripheral vision at home? While you may notice obvious changes, comprehensive evaluation of peripheral vision requires specialized equipment used during professional eye examinations. Researchers continue emphasizing that not every important health change produces obvious symptoms. Routine preventive care, including eye examinations, helps identify changes that might otherwise go unnoticed for years. The next warning sign is one many people attribute to getting older or simply needing a stronger pair of glasses. But when it appears suddenly or continues getting worse, it's worth having it professionally evaluated. Let's look at warning sign number 6. Warning sign 6, seeing double. Occasionally seeing double after rubbing your eyes or when you're extremely tired may happen from time to time. However, persistent or sudden double vision should never be ignored. Researchers explain that double vision can have many different causes. Sometimes it may involve the muscles that move the eyes. In other cases, it may be related to changes affecting the nerves, the eyes themselves, or other medical conditions. The important point is that double vision is not considered a normal part of healthy aging. Rather than trying to guess the cause, eye care professionals recommend prompt evaluation so the underlying reason can be properly assessed. Does double vision always mean something serious? Not necessarily. There are many possible explanations. However, because some causes require timely medical attention, persistent or sudden double vision deserves professional evaluation rather than simply waiting for it to improve on its own. One of the biggest misconceptions about eye health is believing that every vision change is caused by aging alone. Researchers continue emphasizing that while aging certainly affects the eyes, new or unusual visual symptoms should always be taken seriously until they've been properly evaluated. We've reached the final warning sign. Interestingly, this one doesn't always begin in the eyes themselves. In some cases, changes noticed during an eye examination may even provide clues about a person's overall health. Let's finish with warning sign number 7. Warning sign 7, sudden loss of vision in one or both eyes. Of all the warning signs we've discussed today, this is the one that should never be ignored. A sudden decrease in vision, whether it's complete vision loss, partial vision loss, or the feeling that a curtain has come over part of your vision, requires immediate medical evaluation. Researchers and eye specialists recognize that sudden vision loss may have many possible causes. Some involve the eye itself. Others may be related to blood flow, the nervous system, or other medical conditions. Because early evaluation can be extremely important, healthcare professionals recommend seeking urgent medical care rather than waiting to see whether vision returns on its own. If my vision comes back after a few minutes, should I still have it checked? Yes. Researchers explain that even temporary episodes of sudden vision loss deserve prompt medical assessment because they may indicate an underlying condition requiring evaluation. One of the most valuable messages in healthy aging is this: your eyes don't simply help you see the world. They can also provide important information about your overall health. That's one reason regular comprehensive eye examinations remain an essential part of preventive healthcare throughout later life. Let's quickly review today's 7 early eye warning signs. Persistent blurry vision, new floaters or flashes of light, increasing difficulty seeing at night, straight lines appearing wavy or distorted, gradually losing side vision, persistent or sudden. Double vision, sudden vision loss, many vision changes are a normal part of aging. However, researchers and eye specialists continue emphasizing that new, persistent, or rapidly changing symptoms deserve professional evaluation rather than being dismissed as just getting older. Can healthy lifestyle habits help support long-term eye health? Researchers continue studying how overall cardiovascular health, balanced nutrition, regular physical activity, not smoking, and managing chronic medical conditions may support healthy aging, including healthy vision. How often should older adults have their eyes examined? The appropriate schedule varies depending on age, medical history, and existing eye conditions. An eye care professional can recommend an examination schedule based on an individual's specific needs. What's the most important takeaway from today's video? Pay attention to changes. Many serious eye conditions develop gradually and painlessly. Recognizing new symptoms early and seeking appropriate professional evaluation may help protect long-term vision. I hope today's discussion has helped you better understand some of the early eye warning signs that researchers and eye specialists encourage people to recognize. Remember, healthy vision is an important part of healthy aging. Staying informed, paying attention to changes, and having regular eye examinations all contribute to protecting your eyesight over time. If you found this video helpful, please like, subscribe, and turn on notifications so you don't miss our future evidence-based men's health videos. And I'd love to hear from you. Which warning sign surprised you the most today? Share your thoughts in the comments below. Thank you for watching, and I'll see you in the next video.